Lorna Warwick, and I'm the CEO of Lymphoma Coalition. One of the things we learn from our global patient survey that we do every 2 years is there are still some gaps in communication between patients and their doctors. And this becomes important because, of course, patients are searching for lots of information. And if they're not getting the right information from their doctors, then they go looking oftentimes, into Google, and patients don't often have the right information about their diagnosis to make sure that they're searching for something applicable to them. So that becomes an issue, but also an issue because doctors have a tendency to set the topics that are acceptable to talk about in a patient-doctor relationship. When you think about it, patients come into care and they know nothing really about cancer. They have to learn terminology they're not used to. They're shocked by their diagnosis. They don't know how they're going to feel, and that varies quite a bit during therapy about how patients cope, or if they're in active monitoring, how they adjust to that. So they're dealing with a lot of new terminology and new change to their life. And so they really are looking to their doctor to help them set the course. So we know from the survey that most doctors are empathetic, right? So they are expressing to their patients that they feel really sorry for them, that they're going through this. But what is missing is doctors are not necessarily responding to some of those key issues that patients are facing. So what happens over time is patients stop talking about some things. So they only focus their conversations on those topics that doctors have stressed are important, and those are usually medical, right? So I have fevers, doctors will respond to that. I have some pain, doctors will respond to that. What they don't respond to, though, is if they mention fatigue, or they mention, their fear, or some, they'll minimize some other side effects that patients might be experiencing that just are medically not as important, like muscle cramping or aches. But those can be quite debilitating for a patient in their everyday life. And so it's like, how do we balance and get patients comfortable enough to talk to their doctors about what is really impacting their quality of life, and get doctors to respond? And we have this gap in communication. And sometimes that's due to time limitations, right? Doctors only have so much time for each appointment. And like I said, sometimes it's because over time a relationship has developed where patients then will only talk about what they think a doctor wants to hear. So one of the ways that nurses could really help is really asking patients, what's really bothering you today? And not limiting it to what's, medically relevant or just anything. Often, sometimes what's bothering a patient is they wish that they were home with their child, or they're missing a family event, or they're just miserable because cancer is taking a lot away from them emotionally, and they just need somebody to listen and prioritize what is important to them. And strengthening any bonds within those clinical relationships with the patient does help overall with that patient-doctor communication. The patient then feels like they have an ally, somebody who not only listens, but perhaps will go to the doctor and say, this is really bothering this patient. How can we help them cope or help them deal with this issue so they have an overall better quality of life? Cancer is not always just about overall survival. It is about how that patient is going to feel, and how they're going to live their life, not only during the therapy, but once they're back out of the clinic or out of care. And so, setting them up so they can talk about all of these experiences in a meaningful way, and get some then related support back is really important. And we just like to, again, acknowledge not all the support has to come out of the hospital or the clinic. There are community resources available, including patient groups that have different kinds of support programs and educational materials that can help. And so please look around your community, see what else is available, to make sure that you're giving the best support and care possible to patients.